Hi, I'm Henry Holstege, one of the authors of this book. And I'm with Mike, who will introduce himself, but we are going to deal with the topic of death and dying.
I'm Mike Faber, and I'm also one of the co-authors of Introduction to Aging. And death and dying, especially when I teach this subject area with students, very often their first impression is, especially when they tell their family or friends they're taking the class, is why in the world are you taking that? And why are you interested in that subject area? Most of the students, however, at the end of the semester say, wow, this was very enlightening. Why? Because we're a death-denying culture.
And the fact is, Mike, you and I know we did a tremendous amount of research throughout the world, and the fact is this: you are going to die. Everybody dies. Now, it is also true the older one is, the higher the probability that one will die soon. And probability is before you, Mike. But the reason I say that is you ought to be talking with your parents and your grandparents about, are they prepared to die and what do they want? And the question in part is, do they have a attorneyship for a relative to take care of their decisions when they are incapacitated? The durable power of attorney for medical decisions.
Those advanced directives are really, really important. But I think a lot of it is just talking about it. People are afraid to talk about this subject area because death is taboo. The reality is, however, that when you talk about it, most older adults actually are waiting for their family members to approach them and ready and willing to talk about this subject area. The more you know, the less fearful you become and the more you understand about the subject area. This is one of the reasons I think we wrote about this.
Yes, and the question is, when did you last talk to a relative about death and dying, about funerals, about the estate, about what the dying person wants? And let me add very quickly here, America and European countries are lucky in that we have the hospice process. People who are close to death are taken care of very well in a hospital or a home setting.
Yet hospice is underutilized. Most people do not take advantage of it, or if they do, only in the last few days or hours of life, and they don't get to take full advantage of it.
And we explain in the book exactly what hospice is, when it started, and how it should be used.
So these are just some of the reasons why I think this is a significant chapter in the book as well.